This evening, I'm really delighted to have on the program Dr. Danny Eckert, and he is from NeuRA, Australia, and he's going to be talking to us about sleep. I guess that's something we all need a bit more of, and in particular, he's going to be talking to us about his research into obstructive sleep apnea, and he'll tell us what that is about. And then the second half of the program, we're going to be talking to Dr. Peter Dingle, and he talks about sustainable health, so we'll find out what that's all about. So let's not waste any more time and let us talk to Dr. Danny Eckert. And good evening, Dr. Eckert. How are you?
I'm well, thank you.
Good, and we can hear you loud and clear. That's good. I'm pleased that we've got you from Neuroscience Research Australia, and you're our second interview from the organisation. So that's I'm really excited about that. So before we get started, though, I just want to ask. I noticed that you did your PhD in Adelaide.
That's correct. I'm certainly from Adelaide, and it's been, I guess, 5 or 6 years since I've lived there, but Adelaide has certainly been home.
Oh, great. Yes, I saw that and I thought, I'll just ask you about that. And and you have travelled quite a bit since you were in Adelaide.
That's right. I spent about 5 or 6 years in Boston, and I've been in Sydney for about a year now.
Oh, good. So any chance you'll come back to Adelaide?
Oh, you never know. You never know. Sydney's pretty good thus far, so...
That's good. Well, I guess it doesn't really matter where you are as long as this research is happening. That's the main thing.
Absolutely.
Good. So, do you want to explain to us what sleep apnea is, perhaps, in the first place? Is that how you'd like to go about this, or?
Sure. Yeah. I mean, sleep apnea is the main condition that I work on, and essentially, with sleep apnea, it's a condition where people go off to sleep, and they're still trying to make efforts to breathe, but they're unable to do so because the upper airway actually narrows or closes, so they can't get enough air into the lungs. And this happens over and over again, sometimes up to 100 times per hour. So as you can imagine, they have a really disrupted night of sleep, and there's sort of many consequences the next day in terms of sleepiness and neurocognitive impairment and cardiovascular risk and many other health consequences that are associated with sleep apnea.
Yeah, and I suppose it wouldn't be easy on a relationship either.
No, it certainly can be tough for the bed partners, and in many cases that's the way that the patient first comes to the sleep clinic, is that their partner simply can't sleep anymore, or they're worried about it so much. It's, as you can imagine, it can be quite distressing being next to your bed partner and witnessing them stop breathing.
Yes, yeah, no. And so is there a known cause for this?
Look, there are, and that's really what I work on, is trying to identify the causes, and I think causes is the right word. There's not one cause that fits all, and so there really are a number of different factors. Things like having just anatomically a narrow airway can contribute, but there are many other factors, how well the muscles in the airway work when you're asleep, how easily you wake up, how strong the breathing signals are to tell you to breathe. All can play a role in determining whether or not you've got sleep apnea and how severe it is.
And this is really, it's basically the luck of the draw, would that be?
Look, there is, like most things, like most disorders and diseases, there is a genetic component, but there are certainly many risk factors with sleep apnea, that some of which are modifiable. Things like obesity, for example, is the number one risk factor, and it's certainly not easy, but there's some things to do there to try and to modify that factor, and that can really reduce or even in some cases eliminate sleep apnea.
Okay.
But yeah.
I read that in the information that you sent through, and I don't quite understand the correlation between obesity and this condition. Could you explain that?
Yeah, so it's and I mean, I think the honest answer is we haven't completely worked that out, and it's an area of ongoing investigation. But we do know that if you are obese, you tend to have more of a crowded upper airway. So the airway's got many muscles, over 25 little muscles, and it's a confined compartment. So if you've got a lot of adipose tissue or fat tissue around the neck, it places extra pressure on the airway and can make it more prone to collapse. So that's one cause. There's some other causes to do with central obesity, and when you lie on your back, the mass pushes down and can limit your lung volume, which can also have an effect on the upper airway and breathing.
Okay, so that's one way of treating this condition is to lose weight. Yeah.
Absolutely, yeah.
As a starting point.
It certainly does work for many people if they're successful in doing so.
Yes, easier said than done.
Absolutely. Yeah.
And is there an age onset for this?
Look, there is. It's most common in middle age. Is when it's most apparent.
Mm-hmm. And so, if when you were explaining about the muscles that are involved, would you notice that in a child or an adolescent at all?
Look, sleep apnea certainly does occur in children as well. It's actually quite a different disorder in terms of not only the causes, but the treatment as well. So in children, the most common factor tends to be their adenoids and tonsils are too large for their airway size, so that limits their breathing. And in many cases, if they are removed, then that can improve the sleep disorder breathing in children. Not always the case. More and more as we go into adolescence, they are becoming more and more like little adults, and it starts to be other factors are involved whether surgery is not an option.
Right. So I think it'd be good to hear about the research, and there are. I was reading some of the material where there has been a treatment. So the treatment that you have has been used over a period of time. The continuous positive airway pressure, is that oxygen therapy? Is that what I'm interpreting that as?
Yeah, look, it is. With sleep apnea, with the airway actually closing, the throat area collapsing, and often the tongue pushes back and can impair the ability to breathe during sleep, particularly when people are lying on their back. So all the main treatment is actually developed by someone from Sydney, Professor Colin Sullivan, in the early 1980s, and all it is these individuals wear a mask and air is blown in to actually blow that airway open, and different amounts of pressure are required for different people, but it works incredibly well for those that are able to tolerate it, and there's literally millions of people around the world that are on Cpap therapy, and it helps their sleep apnea. Unfortunately, about half of those individuals that try Cpap therapy are unable to tolerate it, so we really need new treatments in addition to Cpap therapy.
Right. And yes, the compliance rate I was reading is not always high.
It's not, and there's certainly lots of strategies to try and increase that, but it's an ongoing challenge, if you like, and I think at the end of the day we really need some effective alternative treatments for this debilitating disorder.
Yes. So I was picturing, I have seen this. I'm not sure whether I've seen it. There's a vague recollection of a couple of people coming to stay with us once and having equipment, and it looked like there was a lot of equipment there, which again, I look at the relationship side of things. To have all that, a lot of equipment in your bedroom, sharing your bed with you.
Yeah.
We can sort of understand why the compliance might be a bit difficult.
Look, the machines themselves are getting smaller and smaller and less noisy, and I guess if you compare it to the snoring and the lack of breathing that goes with sleep apnea, then I know which one I would prefer.
Yes, no, I can imagine. So the newer treatments, or is it the treatment that is under research, or is this is it the hyper? No, you better say it. The nerve stimulation. It starts with a H.
There's an emerging technique called hypoglossal nerve stimulation. That's right. I mean, it's very much in the development and research stages at the moment. But essentially, what that therapy is trying to do is the main nerves that goes to the largest muscle around the airway, which is actually inside your tongue, called the genioglossus. So this device is actually implanted surgically and is attached around that nerve, and when it's stimulated to push the tongue forward to open the airway only when these individuals are asleep. So there's several companies, 3 companies around the world that are actually in the very early stages of testing this equipment in some patients with sleep apnea at the moment. With some degree of success. It's certainly not as effective as Cpap therapy, and is likely to work for some individuals and not others. So it's an interesting technology, and but still quite a lot of work to do in that regard.
Right. So we're talking to Dr. Danny Eckert from Neuroscience Research Australia, and you're listening to A Good Life on Coast FM 88.7. And we're just going to take a short break, and then we're going to come back and talk to Dr. Eckert a bit more about this research into sleep apnea. So bear with us. And welcome back to A Good Life, and I'm Barbara Chappell, and we're talking to Dr. Danny Eckert from Neuroscience Research Australia. And have we still got you on the line?
I am here.
Great. So what is it that, part of the reason for having you on the program is to make people aware of the research that you're doing, and also, is there something that people can do to contribute to that research in some way? Sure.
Yeah. So I guess as I briefly mentioned, a lot of the work that I do is really trying to understand the reasons why people get sleep apnea, and some of the ongoing work that we're doing. We are not only investigating the underlying causes. So we study how the muscles work when individuals go off to sleep, how collapsible the airway is. We measure breathing during sleep and a variety of physiological variables. But we also look at little interventions and small clinical trials to try and manipulate some of those variables in individuals in whom we think these approaches will work. So the idea of sort of novel, individualized treatment is really the emphasis of my work. But there's many groups that are really looking into this problem, and certainly there's a fantastic group there in Adelaide, and at the Adelaide Institute for Sleep Health that does a lot of great work in this area as well. Okay, so if people wanted to contact they would, if they Google the Adelaide Centre for Sleep Health. Yes, the Adelaide Institute for Sleep Health is certainly a leading place or international centre for sleep apnea research at the Repatriation General Hospital there in Door Park. Okay, so a lot of people in this area, in this broadcast area, know where the Repatriation Hospital is, so they can make inquiries there. If people wanted to get in touch with Neuroscience Australia, Research Australia, I have a Sydney number that is on the website, and I'll just let people know what that is. It's 02 9399 1000, and the NeuRA website is www.neura.edu.au. So we get those contact details out of the way, so now we can hear about more about your research. I'm curious about how you got into this area of research. Yeah, look, for me it was I guess it was a bit of an accident, really. I was really interested in cycling, and my first degree was in exercise and sports science. And And then a job came up at the Repap hospital for when I graduated. I was debating whether to work in the Sports Institute or whether to as a exercise physiologist or try something new in the health field, and which I was also always interested in. And I guess I took a bit of a gamble and took a job in the sleep field and worked there as a research assistant for a year and working on sleep and respiratory related projects. And the people were there were just so inspiring and such good people. They really are the folks that inspired me to undertake further studies and do my PhD and really get interested in sleep. And in many ways the physiology is actually somewhat similar. It's, when you're exercising, you're pushing your body as hard as you can, and the system's most vulnerable. And the opposite is true for sleep. When you're at your quietest, and things are also on the other end of the extreme, where things are, in my opinion, also particularly interesting from a physiological point of view.
Right. So sleep apnea is your main area of research at the moment. It is sleep in general part of the research?
Yeah, look, various aspects of sleep physiology I'm interested in, but certainly the main focus is causes and treatment of sleep apnea. But I've done various other things along the past, some projects to do with asthma and looking at reflexes in the upper airway, cough reflex, and these sorts of things. So I've had somewhat of a varied background, but all to do with sort of respiratory and breathing and sleep.
Right. So probably the sometimes with the research you find things that you weren't really looking for. Has that ever been happened?
I mean, that's the fun part of doing what I do. I mean, that you will often go ahead and undertake a study and I think that's the most exciting part of what you do. You'll come up with a research question, design a study, go out and test that question, and you'll either get completely the opposite, or you'll find lots of other interesting things along the way which take you off in a different direction. And that's certainly happened for me in my career, and that's one of the really exciting parts of science, I think.
Yes. Well, I know with community radio, because when we are learning to be a panel operator, you have to do the night shifts or the early morning shifts. Yeah. So a lot of people up at that hour of the morning not being able to sleep, and so there's probably lots of research potential in our program or in our radio station. Do you have enough candidates for the research?
Look, I mean, sleep is a big problem. I mean, you touched upon it there with there's up to about 20% of the population works in some form of shift work. So yeah, it can be challenging on the body in many respects. But for the majority of our studies, we have fantastic volunteers that come in and take part in these studies, and we're certainly very grateful to them. But of course, we're always looking for more volunteers, and always appreciate folks that put up their hand to come and volunteer to do research.
Right. And do you see this occur in families? Is there any genetic connections? As we did when we spoke to Dr. Brooks about Alzheimer's, there was quite a genetic pattern there.
Yeah, look, there is a familial component. It's the complex part about sleep apnea is it's certainly not one gene, and we certainly haven't identified many standout candidates in that regard. So, and it's related to all those other factors that I briefly talked about, that being middle age, the obesity. That being said, thin people also get sleep apnea, or can also get sleep apnea. So it really is quite complex. So I don't think there's ever going to be a single gene for. Well, I can certainly say there's not going to be a single gene, I think, for sleep apnea. So there's some genetic predisposition for the risk factors. How that all interplays and works out in an individual sleep apnea remains to be seen.
Right. And one of the notes that you sent through, you talked about insufficient sleep, but also possibly too much sleep can be associated with many adverse health outcomes. So could you talk to us about that? Because we always, are concerned about not getting enough sleep, but too much sleep?
Yeah, look, that one has got us all a little bit puzzled at the moment, but the data is becoming more and more strong on that particular variable. So we've known for a little while that if you get less than 6 hours of sleep per night, you're at increased risk of many adverse health outcomes, including premature mortality. But the same also seems to be true if you sleep too much, and that's a lot harder for us to figure out. And these are, I mean, I should point out that these studies are large population studies where they've asked about sleep by a questionnaire. So it hasn't been carefully documented objectively, and there's still some questions concerning that. But the signal seems quite strong in those types of studies that, yeah, if you sleep for more than 10 hours a night on a regular basis, you've also got an increased risk of mortality. And that may be due to other confounding diseases and so forth, but as best they can in those studies, they try to control for those, and the signal still seems to be there. So certainly a bit of a puzzling one at this point. Yeah,
that is a puzzle, and so I know when I was studying, I didn't quite get enough sleep, and it does have an impact on you. We were talking, when I talked to Dr. Brooks, we were talking about memory and the impact that lack of sleep can have on memory. That's and all of the other side effect, well, I guess impacts that you talked about, that lack of sleep can happen when you're not getting enough sleep. So at the moment, the main treatment for people is the continuous positive airway pressure.
That's right.
And the other one is for people to look at weight loss.
Correct. Yeah.
Anything else that you might want to tell us before we have to come to this interview has to come to an end?
Yeah. Look, there's probably the second line therapy is a dental splint, something called a mandibular advancement splint. So you wear a mouth guard fitted by a dentist, and it actually pulls the jaw forward a few millimeters, and this opens up the airway space behind the jaw when individuals go off to sleep. And this is certainly not as effective as sleep apnea, but in some studies has been shown to be something that these individuals will wear more often. So, and it certainly does have some great therapeutic utility for many patients. So that's another alternative that we have at the moment.
Okay, so there is treatment, and this a condition like this is not something that you have to live with. There is treatment that people can get. So to contact. Now, what was the institute at the Repatriation Centre? I didn't actually.
The Adelaide Institute for Sleep Health.
And that's at the Repatriation Centre. And the other group to contact is Neuroscience Australia, and they have a website, and it's www.neura.edu.au. So. Danny, thank you so much for joining us on the programme this evening. I did want to talk to you about the big dig in Boston. Were you there when that was happening?
Look, I was. It went on for a long time, but finally it's been completed.
Yeah. Yes. So that would have been enough to keep everybody awake, wouldn't it?
Yeah, absolutely.
Yeah. Look, thank you again for joining us. I really appreciate your time, taking the time to talk to us, and all the best with the research.
Many thanks.
Great. Thank you. Bye-bye.
Good night.